Hi everyone, my name is Christina. I'm 25 years old. I'm from India. I don't even know why I'm doing this. So, I recently got diagnosed with dissociative identity disorder, DID in short. Um, well, the thing is that this was the first time that I actually got a formal diagnosis. Actually went into the hospital because of prolonged depression, and towards the end of last year I just kept getting more and more panic attacks, so they were just more prevalent and longer and more frequent. So that was not good for my mental or my physical health because a lot of stress was actually being put. So that's why I just thought that I would just go and get myself checked. Well, like every other Indian child who would try and go and tell their parents that probably I have depression, and they just said I just watch too much TV, or that I'm just talking about depression because I want attention. So hi, I'm here to get attention. No, not really. I do not want attention during my panic attacks. Nope. I guess I just wanted to stop feeling shitty about myself. Maybe. So that's why I sauntered in with one of my friends to the hospital, all decked up like this because, hi, I am like this usually. And I first got diagnosed with high functioning anxiety disorder, where I actually had like a team of people who were treating me and helping me understand as to why I'm having the panic attacks, and usually that's just a coping mechanism. And things were not really going really well in personal life, and that's how I started getting my treatment. I started getting my psychologist consultations and therapy sessions and everything else. And then along the way, there have been times where I would just randomly forget that I had an appointment or that I had panic attacks or how to deal with my panic attacks. And that was weird, right? And uh, although my psychologist really, my team didn't really tell me that this was going on because they were still trying to figure out what exactly is happening. If it is just the panic attacks, so they were just trying to understand more about my lifestyle and everything else. So I actually started maintaining like a journal on a daily basis. I used to do that previously when I was younger. Then again, I have a mother who's extremely intrusive. So I started maintaining a journal which I used to take along whenever I had my sessions. And then there were a bit of inconsistencies that used to happen because half of the time I didn't even know why I was going to therapy or why I needed therapy. And I didn't even know that panic attacks actually existed because some of the time I just wouldn't realize I have panic attacks. Weird, right? My friends were shit scared. I mean, I would be too if I was in their place. And it came up in one of our sessions that this actually was happening because I have always been internalizing trauma. So basically, when something bad used to happen, instead of like speaking it out or anything, I used to keep that within myself because obviously I didn't trust people around me. And what that led to is for me to develop a coping system that kind of compartmentalized all of these bad memories and the trauma that I had and would make me forget them. So that's basically what DID is. DID is when it's your brain's way of coping with a trauma or multiple incidents of trauma um, by making you forget it, right? It just you still have it somewhere at the back of your head, but you don't actively know, right? And usually what happens is as you grow older, if there are any triggers, anything that actually kind of reminds you about what happened earlier that was similar to the traumatic situation that you had, that's when you usually have a panic attack, or that's when the alters actually come out to save you from it. DID usually is basically a person starts developing DID when they have undergone severe traumatic situations at a very young age. Simply because when you're really young, that's basically when your entire personality develops, right? When you're born as a baby, you basically just have your basic instincts that, I'm hungry, or I'm sleepy, or things like that. I want to go to the toilet. And then as you grow older, like 3 or 4 years old, that's your parents start teaching you things, right? That what is right, what is wrong, what is good, what is bad, what is hot, what is cold, the pain sensations and all of that. And then as you grow older, to just around the age of 7 to 9 or so, is when you start thinking for yourself. You start getting your survival instincts and all of those things. So what happens is that if something really, really bad has happened at that point of time, right, your brain hasn't completely developed and you're still learning to deal with situations around you in general, and something extremely traumatic happens, usually it's either with physical, sexual, or emotional abuse, probably repeated incidents of it. And then what happens is your brain obviously goes into the fight or flight mode. Now you're too tiny to fight, right? So, and then you basically can't run away, because usually all of this trauma is either caused by someone who is either your parent or your family member, or like someone really close to you. So you can't basically physically run away. And then what happens is your brain just triggers this chemical reaction where you would have a certain part of it that would just try to save you from that situation psychologically. So that's when you start developing alters. Your personality gets split up. You have this child that who is extremely vulnerable, who is in an extremely volatile situation, and then a part of your brain is just like, no, I must protect this child. I must protect this from uh, going through the traumatic experience. So what basically happens is it just takes your memories away. And then because as you grow older, then again, you have this certain part of your memories that are just kept locked away because you do not know, or the brain doesn't want you to know what's going on. And then you have these other alters that come in. So, and then, you just go on for years without actually knowing it. And it's not that uncommon, like it's basically just like you forgetting something. Like probably if your friend told you to call them back because you were busy doing something, and you'd be like, yes, I'll call you back, and then it just slips your mind. This is exactly what happens with us. It's just that it's to deal with our trauma, right? And well, mental health in general in our country is not really accepted. It's always a taboo. Most of the people keep saying that if you have voices in your head, you're possessed. Well, yes. DID was previously known as a multiple personality disorder, and even now it's a bit controversial in even in the psychiatric field, because, well, the thing is that they have that perception that you're still the same person. So ideally, you're just trying to give people an excuse to be a shitty person. Not really. Nobody wants to be a shitty person. I mean, there are assholes around, but still, not all of us are like that. Right? Yeah, so basically, my system, we have about 6 alters so far that we are aware of, and we didn't really know that we are a system. It was basically just a voice in my head. And uh, and that's fine, right? Everyone has a conscience, a voice in their head that actually tells you what's right or what's wrong and everything. But then things started getting kind of fishy because there were times when I wouldn't know what I'm doing at a particular place or with a certain person because me, I wouldn't be with that person. I wouldn't even talk to such a person. I wouldn't even do something like that. So that's where, I came to know that something's a bit off. And then we like had our friends. I'm sorry, I'm using plural terms because we are a system, we are multiple people. We like to refer to ourselves as we. Now, usually that doesn't happen. I know the people I come in contact with don't usually say that, you've never used that before. Yeah, that's because the system is made in a way that it does not, it's supposed to go undetected. You are not supposed to know that we have multiple people inside our head. That's what DID is. It just helps a person cope with everyday life and all the stress and everything and function like a normal human being. Now, see, I'm not saying that someone with DID or any mental health issues is somebody who's not normal. I'm just saying that the normal part is what the entirety of society actually labels as normal and abnormal. You have voices in your head, you are not normal, child, at all. Not really. I mean, I'm really good at what I do. I'm pretty. I am good at my job. I cosplay. I have a lot of different talents thanks to my alters. I mean, I've never felt any issue with having DID. Although I didn't quite know that I had DID, but then it's fine. I mean, if I am the best at what I do and what I can do, and it's helping me live a really good life, doesn't really matter. But I think what we all need is that although me as a person, me as Christina, I have no problem in going on with life and in things I do and everything else. Having people around me that actually understand me and support me and make sure to tell me that it's okay is really important, right? And a lot many people didn't really know what DID was. Like, of course, I when I did get diagnosed officially, I did tell my friends that I have DID, and they were just like, "Oh, okay, yeah, that's cool," because they have never seen me having my dissociative episodes and such. I have always been Christy. Just I have my good days when I'm like nice to people, and then I have my bad days when I'll be calling you out on every single stupid shit that you would be doing. And they were okay with it because it's technically part of my personality. We need to be more open to talk about mental health because we didn't really choose to be this way. This was not like a choice that we had that you can pick this or you pick that. We just develop things based on the environment that we put in, based on the situation that we're placed in. And that's way beyond our control. We can't really do anything. But then, they, like, as a society, as people, as other people who actually see someone who has a mental health issue, don't just randomly say that, we are doing this for attention. We all didn't actually stigmatize mental health and things like that, that probably you don't understand as a person because you are not experiencing it, does not invalidate it at all. I mean, if you would be more open to talking to somebody instead of trying to judge them with the first sentence they say or trying to bring them to your, what do you say, your thought process, you would actually ask them to just talk it out, let it all out, we wouldn't have so many issues in the first place. Do you know how many people are actually scared to go to a psychologist or go for therapy simply because they do not want to be, the center of attention of their friends and their family? People tell you if they feel down, don't say that, oh yeah, that's okay, it'll go away, because sometimes it just never goes away. I had been in depression for over 4 years. That's not a short time. Over the 4 years, I forgot who I was. There was day in and day out, I was just trying to get through, just not try and kill myself. It's not easy. And if you do not, like, if you've had a happy life without any issues or anything, you're one of the lucky ones, right? Everyone's not that lucky. So don't invalidate us. So, yes, I think I would be ending this now. You would be hopefully seeing more videos from my end, and you could probably look forward to my alters actually coming and telling you things, probably telling you about themselves, how we work, and everything else. And if you do have like any questions specifically, I know that I have gotten a few questions from a few people which I would be answering in my upcoming videos. But if you do have any specific questions for me or anything, just let me know. You can mention that in the comment below, and then I'll see how much I can address